Hi there, this is Dr. Michael Scherer. We're going to go ahead and talk a little bit about locator fixed, especially how we go ahead and we remove our locator fixed prosthetics from the mouth. Since locator fixed is a revolutionary new style design that has no screw channels and no screws, it uses a very specialized type of housing and locator fixed insert within the housing to provide a prosthesis that holds rigidly in place on top of your implants and your Zest locator abutments. You may even say, gosh, is that really even possible? Absolutely. That prosthesis is on there rigid, so I'm going to go ahead and give it a really, really firm tug. It's not moving at all, and I'm going to, seriously, there's no way I can remove that prosthesis from this model. Then you ask yourself, how do you remove it clinically? Essentially, we're going to go ahead and use a small little crown and bridge tapper-like tool called the locator fixed insertion removal tool. And when you plunger it or you pull the lever on right here, it creates a little popping sensation. And that popping sensation doesn't pull aggressively hard or anything. It just makes a little bump. If you hold it with your fingers and just lightly hold it, it barely moves. But the goal of the locator fixed insertion removal tool is when you pull firmly from an occlusal direction and pull up while popping, it just provides enough dislodgement to go ahead and remove the prosthesis. Let's go ahead and show you up a little bit closer. Taking a look a little closer at our fixed insertion removal tool, we have a little wire end that goes into our crown and bridge tapper. I'm going to take my finger and pretend like that's the prosthesis. I'm going to come up underneath it, pull vertical, and give it a couple little bumps while we go ahead and do that. When we take our patient's prosthesis, our goal is we're going to go ahead and slide that wire end underneath the distal portion of the prosthesis on either side of the prosthesis. And the goal is that when we're with our patient, we want to hold as vertical as possible. Knowing, understanding that we have a maxilla or we have a mandible in the way, you can get pretty darn close. Maybe not exactly perpendicular, but as close to perpendicular as possible. Now the goal is that when you hold, you're going to hold vertical while giving that little bumping sensation. When we do that, we're going to hold vertical, give it a little pop, and we can see here that it's dislodged the first portion. And I start working my way across to the other side of the arch until it dislodges completely. And you can see removing the locator fixed prosthesis is really pretty streamlined. If we compare that to our traditional full arch screw retained prosthetics, a lot of times I have to book in my chair approximately 30 minutes of chair time for me to remove a 4 to 6 implant screw retained fixed full arch. Versus locator fixed, I can remove that prosthesis in approximately 20 to 60 seconds. Locator fixed is a truly incredible way to go ahead and see our patients on a regular basis now. Easily pop that prosthesis off, throw it into an ultrasonic, change the inserts back in the patient's mouth in just a few moments.